Now, this title I think is very important because the earlier we intervene with this magic diet, which it shouldn't be magic, it should be just the natural, normal diet, the earlier we can intervene, the better, obviously. And there's this interesting correlation that 1 billion people are obese in the world, and these are these dramatic maps in red. And there's also, interesting, 1 billion people with mental health in the time frame we're talking about, the last 10, 20 years and the future 10 years. So why is there this correlation? Very interesting. And again, when can we intervene at the earliest time? Well, the first thing we have to discuss is what is normal, and what is the range of normality from what we think is completely normal to frank disease. Well, first of all of us fluctuate throughout the day, and the early afternoon after lunch is called the Bermuda Triangle of the brain. Make sense? That's why we should all have naps. And after that, hormonal conditions in women and men lead to fluctuations in their decision making, sometimes dramatically. And don't think it's just women, it's men too. There's a very interesting story about the London Stock Exchange and people on high testosterone levels, this is in men, making rash decisions, for example. And I'll give you, those references are appended to this talk. Then there are the so-called neurodiverse disorders, which for some jobs and conditions are highly advantageous, like autism spectrum condition. Remember, it's not a disorder, it's a condition. And then there's also impaired outlook and perspectives amongst people. And this can be directly related to poor nutrition as well. And for us neurological people, my background is in stroke and cognition. For the last 20, 30 years, we know that you can test completely normal on neuropsych testing and a range of cognitive tests, but your PET scan can be abnormal, showing, for example, Alzheimer's disease. And then, of course, ultimately, you also have frank conditions. There's a spectrum of normality in dementia, 5 different stages. And for us neurological clinicians, it's particularly perplexing because many brain lesions are completely silent. You can have silent heart attacks, you can have silent strokes. Some of our presentations are very fleeting, lasting seconds or minutes, and we'll talk more about that. People often ignore those because they're transient. Oh, I got back to normal, so there can't be a problem. But more interestingly, you can have strokes, particularly of the right hemisphere, where people actively deny that there's a left-sided paralysis. And we call that anosognosia. One of the things doctors do is tell you the same thing that you told them in English back in Latin and Greek. And of course, when to intervene given these conditions. And I think the iceberg analogy is particularly pertinent. So many of our dramatic mental and neurological diseases have subclinical behavioral presentations. Anger, irritability, for example, impaired outlooks and perspectives, all these kind of things. Now, it just so happens that the prefrontal cortex is more developed and more configured and more interconnected in us than any of our lineage in the past. It's also the most sensitive. And we today are concentrating on stuff, we're multitasking all day long on our computers and so forth, and that particularly stresses the prefrontal cortex more than anything else. And if you overdo it and you then factor in lack of sleep and a low-fat, high-carb diet, this dramatically impairs this ability, and instead of having a top-down influence, you have a bottom-up decision-making from the amygdala. And that's when you have rash decision-making, incorrect decisions, shooting from the hip, and so forth. So this interesting coincidence of 1 billion people with metabolic disease and 1 billion people with mental health disorders, not surprising, there's a strong bidirectional connection between the brain, between brain fitness and your overall body health fitness. So why should we be surprised about this? Not really. I'll give you new information too, unless you may know this already, that mental disorders such as schizophrenia, bipolar disease, depression are not really distinct entities. They may all come from a common brain energy failure, i.e. a mitochondrial failure, which are the energy houses of our cells, and some neurons, by the way, have up to 2 million mitochondria per cell. It's got to be something important there. And by correcting our metabolism, can we restore this range of neurological and psychiatric conditions? The answer is yes, the short answer. Some of you may be aware of this, that the number one risk factor for 17 leading diseases in the United States is diet. I think this is important stuff, and I don't know if Peter mentioned this. Remember, he may call himself Peter, and I would say Peter. I also have a southern accent, but from the southern hemisphere. And then I thought this diagram was particularly instructive from the New England Journal of Medicine, that 20 to 30 diseases that we treat and think are separate entities can all be attributed to being overweight and having metabolic illness. Now, at the cost of repeating things you have heard before, I think it's very helpful if somebody who's been in the game for a few decades, if you can learn from them which are the best references, source material, to further the word about this kind of condition, I think it's useful. You know, there's a huge amount of information out there, but we don't always know which is the correct one and which is the best. So these are scans I've collected over the last 30 years. I have a whole bunch of these from the various stroke centers that are started in the United States. And this shows you how your gray matter, the figure on the left, especially in the frontal cortex, shrinks when you are out of shape, when you have abnormal metabolism. Not only does the gray matter shrink, but the white matter, which is this increased white matter in the brain, this is not normal. There should be none of this. This on the periphery is just the fluid. But these little spots, we call that white matter changes. Again, I'll give you the Latin term, leukoariosis. And the radiologists for about, 25, 30 years said this is consequent to normal aging. Now, this is one of these many things that have been overturned in medicine. What we thought was normal is no longer normal. I don't know if this has been said many times before, but when I was a student, they told us one day, of the 50% of stuff we teach you, 50% is going to be wrong, and we don't know which 50% it is. And I think it's actually more than 50%. Anyway. Now, the neuroarchaeological record is very, very instructive into not only telling us what we should be eating, because we can deduce a lot from that, but also what's happened to our brain size. You know, people find skulls buried all over the world. And there's a strong evidence emerging that our brains were at time. Can I go back one? Thanks. Our current brain capacity inside the skull is 1,350 cc. There was a time when our brain size was 2,000 cc, plus minus. And guess where that skull was found, Peter? In South Africa, not Australia. It was called the Boskop skull. But certainly the Cro-Magnon people that were discovered in France, their skull size was 1,800 cc. It was a lot bigger than ours. And since then, there's been a dramatic drop. Now, I don't think we need to be too concerned about the size, although that's important, but the connectivity may be even more important. So what is one of the major factors that has led to this problem? This book emerged just a few, I think 2-3 months ago. It's really a compendium of the history of sugar, and I picked up some very, very important facts about it from it. there was a stage in England that sugar was used for treating cough because they thought if honey did it, why not sugar? Because it must be better. It's sweeter than honey. Think of that. It first appeared in Asia, and Taiwan was the biggest producer for a long time. But the sad part is, and there's many, many sad parts about the whole sugar industry, is that 2/3 of the millions of slaves were directly channeled into the sugar plantations across the world. One of them was in my country. Yours too, Peter. Australia. Brazil, of course, the Caribbean islands. And how far back did this sugar ingestion go? Well, we know from the Egyptians over 3,000 years ago that they were on a high carbohydrate diet. They grew a lot of wheat, for example. They were bread eaters. And I found these studies very, very interesting, that they scanned these mummies and CAT scans, and you can see the cardiac calcification in the coronary arteries. You see the calcification in the carotid arteries. And these were in relatively young people. So a lot of Egyptians died at a young age. So that's, at that time, we had a problem with high sugar intake already. And what were the historical sugar surges? At least as far as we know, 10,000 years ago, when farming was initiated in the Middle East area, that was one. Then about in the years 1500 onwards, when the seafaring nations distributed spices, etc. Particular problem in the British Commonwealth in the mid-Victorian diet. And I read something interesting, that at the time of the British-South African War, in the late 1800s to 1900s, 1902, about 25% of the British soldiers were too fat to be enlisted, which is interesting. Today, about a third of US applicants to the US Army and military forces are also too fat to be enlisted. This is a picture from my home city, Durban, South Africa, and the countryside is littered with what they called green gold in those days, which of course it is not. And as a youngster, as a teenager, I often asked my parents and my teachers, why are there these massive sugar terminals in the Durban harbor? These things are huge. I'm sure this is even bigger than in Texas. They are absolutely enormous. I said, why do we need such big storage places for sugar? They said, because sugar is energy. Do you remember that? We were told sugar is energy, and don't you want energy? Or do you have symptoms of fatigue? Yeah, if you're on a high carbohydrate diet, you'll often feel fatigue. Well, you need more sugar. That's what they told us. Now, we've been over this a lot before in previous talks, and should be nothing new. There's a lot of evidence, and it's occurring all the time, that the ketogenic or keto type diets, and there's at least 7 different kinds that I could figure out, they certainly work in a lot of neurological conditions. And today's discussion is not so much about what the evidence is, because there is a lot of evidence so far. The cellular mechanisms whereby this works is also well known. You probably know that it was first established for treating refractory seizures in children, and the effects were dramatic. And since the late 1990s, first spearheaded by Johns Hopkins University, it's been reintroduced to control refractory seizures, not only in children but also in adults. And this is after about an 80-year hiatus where it was not used, when people used drugs. But in drug failure epilepsy, they use a ketogenic diet. And the effects are quite dramatic. Now, certain variations of the keto diet, such as the medium-chain triglyceride diet or the modified Atkins, sometimes seem to have a better tolerance in certain conditions. And here's one on mild cognitive impairment. A very interesting study that showed that executive function, as tested by the trail-making test, verbal fluency, and naming, all improved by following this low-carb ketogenic type diet. And it was corroborated by metabolic imaging, several metabolic rates of glucose uptake by these scans over here. You see the improvement over here. Red means that there is more activity, which is good. So these things work. They work via neuropsychological testing, and they're corroborated by functional neuroimaging. Now, unfortunately, there's some bad news for the new Alzheimer's drugs, like Leqembi, aducanumab, which cost a minimum of $26,000 per year per patient. It's completely unsettled in the neurological community whether one should prescribe these at all, because the effects on cognition are so minimal, yet the potential side effects can be dramatic. And yes, they may work in the odd patient. The last I read was that perhaps 6% of people are eligible to get them in the first place, out of 100%. But even more disturbing is this publication by Seeley, who's a very prominent cognitive researcher from University of San Francisco. And he described this person with 7 different pathologies or 7 different kinds of dementias in one brain. So not only did this person have Alzheimer's disease, but they had other kinds of hippocampal degenerative disease. They had frontotemporal disease. They had Lewy body disease. They had vascular brain imaging, a lot of amyloid angiopathy. So if we try and just decrease the amount of amyloid, which is relevant to Alzheimer's disease, are we really making a difference? And that's maybe why the effect is so minimal. And yet, the number one, the very first thing that goes wrong in a person with mild cognitive impairment and early dementia is vascular impairment. What do you think causes vascular impairment? Metabolic disease. And Peter mentioned this, and many others have mentioned this too, that there's 24 different disorders with one unifying concept. I once suggested a term that are called clinical simultanagnosia, in other words, piecemeal vision. Simultanagnosia just means piecemeal vision. Remember the Latin Greek story in English? And so that is what happens to a lot of doctors. We think hypertension, diabetes, etc., and being overweight are all separate diseases. They're not, they're linked. Now, in what conditions has a low-carb diet been shown to be effective? Migraine is the obvious one. It's the most common neurological disorder. It's really a brain energy failure, and people who are migraineurs actually have a early warning system. Remember, it's a survival advantage to have an early warning system, and that's what migraine is. Can the presentation be super subtle? Yes. Behavioral change, irritability could be the first thing. And I'll get on to the whispering brain syndromes in a minute, but there's also the very, very important retrospective study from the psychiatrists that showed that in their series, they were not only able to improve symptoms in the top neuropsychiatric diseases categories, but also a decreased number on discharge medications. So this is a particularly important study to take note of too. Now, why do we tell personal stories? Now, many of you have given us a personal story. Peter Bruckner has, I know that Tim Noakes had a very similar story about his journey with early diabetes, etc. And why is this? Why are they so important? Well, because information mediated by stories are 22 times more powerful or memorable, because it activates many more brain regions simultaneously than a person like me who's trying to data dump information about neurology and ketogenic diet. Now, we try and do both. And I really like this picture from a Nature journal about 18 months ago, showing you these people in the Sudan who at every midday they gather for storytelling. Now, we used to be like this. And thanks to Doug and others, he's allowed us to tell our stories at this forum, which is great. Some of you have heard about TIAs, transient ischemic attacks, which is a so-called warning stroke, if you like, or a mini stroke. They call them TIAs. Transient ischemic means it could just be a blood supply problem, but it's reversible attacks. Now, in 2004, I wrote a letter to Stroke, which they published, and here it is. I suggested we call TIAs TRBs, threatening infarct of the brain, because this must have happened hundreds of times. We had an acute stroke alert in one of the big centers I worked in, and the person said, you know what, I had this fleeting numbness or speech impairment. It went away. And I went to the emergency room, and they found high blood pressure. And they said, that's the problem. We've got to treat your high blood pressure, which they do. And of course, they bring down the blood pressure dramatically, and then the person converts from having no stroke to a complete paralysis. Because it's normal in an acute stroke to have elevated blood pressure. And now we keep it high and let the brain settle it slowly over the next few days. Otherwise, you will convert into major stroke. So that's why I suggested the word TRB. Of course, it never took off, even though Peter Rothwell from Oxford supported me and wrote a comment to that. But you know, once the term is established, you can't change it, unfortunately. So, some dramatic scans. So if you look at the brain circulation, you have the carotid arteries, the vertebrals. Now this circulation at the back of your head supplies your brain stem. If that gets messed with, you can lose consciousness and have sudden death, just like that. Controls heart rate, breathing, etc. Here are some people who had TIAs. So this is these two arteries, the vertebrals, supply the brainstem. Look at the almost 99% areas of narrowing in these arteries. This person had a TIA. So did this person, very similar. These are the carotid arteries. They all presented with very transient symptoms, but they were sitting on an absolute powder keg. They had minutes, hours, days before they could have just died or had a much more dramatic stroke. And this, of course, is an aneurysm, also presented the TIA. Pump problems, ephemeral signs. So this is a massive tumor in the heart. So this is your heart. This is the atrium ventricle. And this is a massive tumor that flops in and out of the chambers when the heart beats. It's called the atrial myxoma. And this person too had a transient numbness. Could easily have been missed unless somebody did a cardiac echo. And in a similar way, some people have very dramatic strokes and you can't find the cause until you look very, very carefully with a transesophageal echo, and you find a tiny little blood thrombosis on one of the valve leaflets, and it's called a Lambel's excrescence. All right. So all of these people present with very fleeting episodes that revert to normal, but if you don't pick them up, you're in big trouble. And that's the reason why somebody came up with the term stroke chameleons. So these are strokes, but they present in a very strange way, so we call them chameleons. And they can take many different forms. Isolated headache, just a bit of dizziness, altered mental status, shaking of an arm like this, and people said, "Don't worry, that's just a tremor." This person had a limb shaking TIA, and you can see the telltale tiny strokes that caused this. And this is because there's a 90% plus occlusion of one of the brain arteries. I saw this young lady a few months ago. She said, she suddenly became paralyzed. And it's happened a few times before, but lasted a few hours, but this time it lasted a week. So she was admitted to a major hospital, and they did $100,000 worth of investigations. They said, "We can't find anything wrong." And she said, "But you know what?" She was a nurse. She said, "My potassium's low." "Oh, no, we can correct that, don't worry." Anyway, cut a long story short, what she had was hypokalemic periodic paralysis. So low potassium, periodic paralysis, comes and goes, related very strongly to a high carbohydrate diet, which she had. In fact, her BMI was 36, and she'd certainly had that, and this was easily treated with just a low carbohydrate diet. Very dramatic presentation. Of course, people get very alarmed. If you become paralyzed, it's terrible. And then they do $100,000 worth of tests. She's still waiting to see how much she has to pay. And Doug especially asked me to mention Huntington disease. This is one of the most difficult to treat neurological disorders. It's strongly inherited, autosomal dominant. And now a study from New Zealand showed that the most difficult parts of Huntington's, which are the behavioral ones, to treat, such as the neuropsychiatric frontal lobe disorders, etc., are alleviated by a low carbohydrate ketogenic type diet. And the movement disorders, which they have too, fortunately we have a drug that controls them pretty well, but that's not what bothers people the most. They're most bothered about their mental status. And so this diet improves those two. The first study in this very, very difficult to treat condition. How do some other people present? Well, they can present with chronoataraxis. You remember, we do this to you. We give you the Latin and the Greek, and you say, what was that? And of course, it is time blindness. So I've seen many people with stroke conditions that, unless you ask the wife or the husband, they say, you know what, he spends 3 hours in the shower. I drop him off at the bookstore, and he walks around for several hours. Is this abnormal? Yes, sometimes it is. And people can have this loss of sense of time, and of course it is associated with a right parietal lesion, which is over here, and the right hemisphere in general is a relatively silent area of the brain, unless the sensory motor tracts are involved. Peter, did you show nice pictures like this about Melbourne? This is Durban, South Africa. Anyway, Melbourne's a very pretty city, one of the prettiest I've ever been. I think this one is too. When I was training as a neurologist, I came across this young Zulu man. He wasn't dressed like that, but some of them dressed like this, who'd imitated everything that we did. For example, when we examined him with a patella hammer, he picked up a hammer and he did the same thing. And first we didn't think much of it, and then when we did this, he did the same thing, and he would just copy us. And it's called imitation behavior. It's only been recognized since 1986 when Professor Lemaitre from France described it. And he had bilateral frontal lobe lesions because of TB, vasculitis in his brain, and he recovered very nicely. But if you don't know about this condition, you might not even realize it. Some people can imitate continuously. Whatever you do, they repeat what you've said, and the psychiatrists call that echolalia. And it's just one of those many things that are very subtle signs that if you don't pick it up, you will not realize that you're treating a very profound disease that can kill a person, can maim them, and yet it's easily treatable. So these are yet again, one of the many whispering brain syndromes that we can pick up. I described this, 10 years ago. You know weight loss drugs? I want to mention that on January the 4th this year, CNN came up with this headline that the FDA is looking into suicidal behavior with the new weight loss drugs. Well, this was about 10 years ago that I described a young woman who was about to be married, and her husband made a comment that she is overweight and wouldn't look that good in her wedding dress. And so she took this drug called phendimetrazine, and she was a runner, and she was found running along a trail, and the person in one of the homes along the trail said this young woman just came into her house and started cleaning and put everything in order, vacuuming. We don't know who she is and why she was doing it. She had what was called a transient environmental dependency syndrome due to this because it caused partial seizure disturbance in her brain, just partial, so she could still function normally. So the imitation behavior can also reflect a problem with autonomy from the environment. So because she ran past this house that looked a bit untidy, oh, I need to clean this place up. So this imitation behavior can have very, very interesting and dramatic examples. What about the depressogenic effect of sugar? I saw a 95-year-old Alzheimer's person a few days ago who told me every morning she seems depressed and then afternoon she's fine again. And we put on antidepressant, but it doesn't work. I figured out that she is having high sugar cereals every morning, and when that was cut out, everything normalized, even in a 95-year-old. Sometimes when brain lesions occur, another whispering brain example is that people can have superlative functions. Now, how on earth do you pick that up? So they go from here to more superior. This is the story of a young veteran who had sustained multiple TBI injuries from IED blasts in Iraq. And he had some minor disturbances, but he lost consciousness a lot, had seizures, and he suddenly became a very good painter. What do you think of these pictures? He also became very good at cooking all of a sudden. He enjoyed music, he had radio talk shows, and he started writing poetry. And we describe this with my students as pan-artistic abilities after traumatic brain injury. So he would appear completely normal to you if you met him, but you wouldn't know unless you specifically asked, have you, any new interests? So again, this is how dramatic the whole business can be. And what are these abilities? Well, they overlap with what we call precognitions, mental telepathy, psychokinesis. And if you want a good review about this, sense of being stared at. Is this a real thing? Absolutely. A lot has been written about sense of being stared at and precognition. Most animals seem to have it, and it first evolved with the evolution of the eye 500 million years ago as a mode of predator-prey interaction. Why does this happen? Is it because of quantum abilities? And this seems to be the best explanation. While we know that biological quantum processes occur, in fact, it's particularly with regards to the microtubules which control the skeleton of a particular cell. And that also leads to consciousness and the way our brain networks interact. And if you think this is all airy-fairy, then take this example about avian bird navigation. From the Max Planck Institute and Oxford University, there's been several publications about the Godwit bird, which can fly non-stop for 13,000 kilometers over about 10 days, no food, no sleep, and get to its point of arrival exactly every year. And these are quantum processes in that bird retina. They have avian navigation abilities. And that's called radical pairs, for what it's worth. And now I'm getting well outside my own area of expertise. And do we have other senses than our five? Absolutely. There's certainly sharks, rattlesnakes, migratory fish and birds have them. Remember that the cetaceans, like dolphins, orcas, have sonar. And is there an eighth sense that we have and that animals have too? There's a lot of evidence for this. And how do we explain it? Now, this is well outside my area. This is about quantum physics, and that Newtonian physics explains large bodies, but at the microscopic, atomic level, a whole bunch of different principles take place, which we have difficulty in understanding. And if you don't believe me, George Green, from the a professor of mathematics at Columbia and doctorate from Harvard and Oxford University. So I don't think you should question his qualifications. He said, yep, this is absolutely true. And he quoted Richard Feynman in 1965, who said there was a time when only 12 men understood relativity. On the other hand, I think nobody understands quantum mechanics or quantum physics. So the physicists know that this exists, but nobody can explain it. And that's because, so why I mention this in relation to neurology? Because docosahexaenoic acid has quantum effects, and that's probably what caused the signaling in the birds and functions in our retina and in every single synapse in our brain. And there's a thing called supramolecular chemistry, and I'll leave the chemists in the audience to explain that, so don't ask me a question about that, please. So DHA is a key component, and it's achieved with a ketogenic low-carbohydrate diet. That's why this whole business works. And of course, Darwin, back in 1850, mentioned many, many times that the two important factors in evolution are natural selection and conditions of existence. And he always said conditions of existence are the more important. And today, of course, we know this is true, and we explain it with epigenetics. And epigenetics basically is the environment controls how our brains and bodies work. And environment means what we eat, amongst other things, of course. Now, the good news is that when we have a stroke or one of these whispering brain syndromes that go wrong, that I mentioned, all those examples, the brain is 4 times more plastic than muscle. Now, if you look at Doug, every year I see Doug, his muscles are bigger. He works out, and we all know that if you work out, you grow bigger muscles. But your brain is 4 times more powerful than that. But we don't see it. But remember that, and this is the supporting study. And factor into the knowledge that, as opposed to the chimpanzee brain, our brain's connections, the major brain networks, are much more responsive to the environmental interaction than a chimpanzee. So we can reconfigure our brain much more effectively than any other animal that we know. And these are the brain networks that appear in green. You don't see that in a chimpanzee brain. Even ApoE4, which we say is a major risk factor for Alzheimer's disease, has certain advantages in young people with cognition. And we can counter the deleterious effects with ApoE4 by doing physical exercise, for example, very, very powerfully. And there's a lot of evidence for that, which I can't go into because they're going to turn off my speaker just now. So we have a golden opportunity, maybe presented over here. So I mentioned earlier there was a time when our brains were bigger and maybe much more intelligent than we are today. That's possible. And then something happened over here. And maybe this was farming. This was farming, and something else happened over here. We're not sure what. But our brain size decreased. Now, surely you don't want to maintain the status quo unless you're super fit. You certainly don't want to degenerate and have a lower health span and lifespan, but you want to do this. How do we do that? There's a lot of evidence now that this can be done, and other speakers have mentioned this. I think the finger trial was one of the most important because it incorporated exercise, diet, and cognitive exercises. And the finger trial has expanded to the rest of the world because it's been so successful. It's now called the worldwide finger trials. And another 10-year population-based study in almost 30,000 people said the same thing. You can do this. You can fix it. And then to end off, I think one of the most important things we need to mention is what about the reliability of our data and how much data is there? There's a lot of misinformation. We know that corporates employ mercenary scientists. They reanalyze, manipulated, make voluminous articles. Anybody remember the cholesterol lowering guidelines? I think about 150 pages long. More doctors smoke Camel cigarettes. Artificial intelligence has hallucinations, delusion, emergent properties, just like the human brain. How do we transfer knowledge, all the knowledge that we have and that is available to us? How do we distill that and teach the next generation, teach you people to make a difference? Well, clinical knowledge is doubling almost every 73 days, and this is old data. It's probably less than that now. Maybe one of the ways is through quantum computing, so that we can rapidly analyze key data, knowing that there's issues with that as well. We know that there's a unifying concept for psychiatric disease and probably all neurological disorders, which is a metabolic failure, and we know how to treat it. This is a lovely diagram to illustrate how all the neuropsychiatric diseases are interconnected. So if you have one, you may have 2 or 3 or 4 others. And then, the good news is if you follow the 5 brain fitness rules, and here they are, you can look forward to being happiest in your 80s. This is real data. There's a reference. So don't despair. And never forget, this is where we were engineered in the first place, in this environment. And the closer we live according to this environment, and Peter mentioned the importance of sunlight, for example, very, very deficient. Vitamin D is a master hormone, comes from sunlight, not so much tablets. And a lot of our treatment today in medicine is this. We tend to treat when there's a disease, yet we need to intervene upstream. And this is particularly well said by this poet. And finally, a lot of what I've said is putting the cart before the horse. And Peter Attia in his book Outlook, which I think is very good, described as medicine 1.0, 2.0, 3.0. 1.0 is what we learned from the Greeks. They were very good observers of the natural world and came up with a lot of laws for us, like the Hippocratic Oath. 2.0 is what we practice today. We wait until a stroke has happened, we wait until you have diabetes, and then we treat with these wonderful silver bullet drugs which do not exist. And 3.0 is what we are trying to instill in everybody today as a group. Treat upstream, treat effectively, treat the real underlying cause. Thank you.
I know that pure autism is a developmental disorder, but I was wondering about if you've ever experienced or what your feelings are on adult onset of several autistic type symptoms.
Yes. Can certainly occur after stroke, which I have a lot of experience with. For the first time, it can be an inherited condition, as you know. I think very often it's associated with a high carbohydrate diet, very much so. And there's a lot of literature to support that, and there's also a lot of literature to support that a high healthy fat diet can alleviate autism spectrum condition, as well as ADHD, and that should be the first thing that should occur. ADHD is also diagnosed in adults secondary to neurological conditions like stroke. Sure.
Yes, hello. David Nabert. I'm a cardiologist, cardiac electrophysiologist from Georgia. First, it's nice to meet somebody that doesn't think Rupert Sheldrake is crazy. But more importantly, we use DHA and EPA for treating hypertriglyceridemia, especially in people that won't go on a low-carb diet. And we found some problems with EPA unopposed with no DHA. So the medication is called Vascepa. As a heart rhythm doctor, there is an increased risk of atrial fibrillation when we don't have DHA and EPA together. Have you noticed any adverse effects neurologically with just unopposed EPA as opposed to EPA and DHA together?
The answer is no, but I can't answer your question because I haven't given those two in isolation. I give them as a wholesome diet, as one of the keto diets or the Mediterranean diet or modified Atkins diet. So I can't say which of those two are more important. No.
Milton Soabe, Ohio. I'm a physiatrist, physical medicine and rehabilitation. Kind of patients I take care of the most are stroke and brain injury. So in my institution, there's no, I mean, patients come in with all these, the diets that they're on, I have no control over. Have you in your institution been able to affect the diet of your patients in the hospital with these conditions?
Yeah, great question, because I've worked in huge medical centers where there's all these departments, and very often I get a deer in the headlights stare from endocrinologists and some cardiologists. Most cardiologists have converted over to the ketogenic advantages, but especially endocrine people, you know, and we know why this is, because they dutifully read all the review articles and CME updates that are ultimately engineered by the pharmaceutical companies through various grants. And this is one of the problems I have in teaching students, and also hospital policy wants you to follow these guidelines, and that is one of our challenges. And I found the only way to fix this in these big institutions is to have a one-on-one direct relationship with cardiology, with endocrinology, and so forth. Make them your friends and be nice to them. Don't attack them. Say, hey, have you heard about this? Why don't we discuss this at a journal club? It works. If you do it that way, it works.
I guess with the nutritionists as well, right? And the dietitians.
Nutritionists also, yeah. Well, they've also been inculcated with these guidelines that, you know, where their guidelines come from.
Right. All right.
Yeah, it's a big problem. That's why I put up that little story about reliability of data and how we can solve this, potentially.
Hi, Dr. Hoffman. Amazing. Thank you very much.
Thanks.
I have actually 2 questions. I'm going to roll them all into one.
Yeah.
So, from an evolutionary point of view, theoretically, females are more able to convert EPA to DHA. And that kind of makes sense because they have to grow a baby and another brain and all that. All right. Now, what is the hypothesis as to why women, why is there an increased prevalence of dementias in women as opposed to men? Convoluted, sorry.
I'm not sure if I can answer your question, because I'm not a biochemist. There are some outstanding biochemists in the audience, I know that. But what I do know, and maybe this helps you, is that both DHA, EPA, and arachidonic acid are critically important to have, but in the right ratios, which is optimally 1:1 or 1:3. And interestingly, if you look at 2 mammals, a zebra and a dolphin, they weigh about the same. The one lives in the ocean. Dolphin has a 1,500 cc brain. The zebra has a 350 cc brain. Why is there a 5-fold difference? It's because of the nutritional value that you can get from seafood. So it's good to have seafood, and that's critical to our dietary intake. But we also need a certain degree of arachidonic acid because the placenta needs a great deal of it for birth and delivery. So that's all I know about that story. I'm not too familiar with exactly the proportion of EPA to DHA.
Thank you.
Sure.
I appreciate you.
Hi, I'm Denise. I'm a nurse practitioner in endocrinology. I hope I'm going to ask the easiest question all day.
Sure.
I work with mostly patients with diabetes, and many times they'll come in and they'll say, my primary care physician says I had a TIA. And I ask, well, how do you know that? And, well, you know, my arm went numb for a little while and my eyesight was bad and then I got better. So my question is, do you need to have imaging to prove a TIA, or can you diagnose it clinically?
Need imaging.
So you have to have imaging,
Absolutely.
and imaging has to show something.
Not necessarily. It doesn't need to show anything. Remember, what do you think the most accurate way there is of assessing human brain function?
I wouldn't know.
It's not imaging. It's what you tell me. what the patient tells you. Peter mentioned this too. Osler said, listen to your patient. They are giving you the diagnosis. So when somebody says, you know what, my arm went numb, that's all you need to be told. This requires a precise explanation. If you ask in more detail, so how did this start? Well, you know, I went to my doctor and they said my blood pressure's high, and then they increased the blood pressure medication, and within hours, suddenly my arm became numb. Maybe they dropped the blood pressure too low, they have a cerebral artery stenosis up here, blood flow's decreased, and it causes a transient ischemia. Not only do you need to image it with an MRI scan and not a CT scan, it's just not accurate enough. You may also need to do vascular imaging, either ultrasound, carotid, transcranial Doppler, or an MR angiogram to look for any plumbing disturbance in the brain. You need to look at the heart. Is something throwing off a clot? So that little arm numbness requires an explanation. If you then decide to ask the right questions and say, well, you know, I do a lot of typing, and these 3 fingers are numb, and could it be carpal tunnel? Yes, you could make a clinical diagnosis of carpal tunnel. And if you're confident enough, then you might forego all that neuroimaging. But you have to be really very careful. And that's where we enter a minefield, because if we get things like this wrong, the consequences can be disastrous. So you need an interested clinician, whatever they are, that listens to you properly. That is number one.
Thank you.
Dr. Hoffman, in your presentation today, you mentioned something about signs and symptoms, small signs and symptoms in migraines, and it reminded me that in your presentation in San Diego, you briefly mentioned auras as a symptom, sign and symptom for something greater. But could you expand on that, please?
Yes. So, remember, migraine is an early indicator of impending brain damage, if you like, or brain failure, metabolic failure, energy failure. And the brain cleverly throws symptoms at you to alert you that something's wrong. So when people have these aura and scintillations and see funny shapes and color, they think to themselves, is something wrong? Am I losing my sight? They take it seriously. And of course we know this is part of what's called a cortical spreading depression. And if you hallucinate, for example, and sit in a dark cave like we did 50,000 years ago and chant, and have, for example, complete quietness, you can also hallucinate not only tactile but auditory and visual stuff. So the brain easily manufactures these hallucinations, including within the migraine spectrum. So it's just an early warning sign that you should take care of. Yeah.
In what way?
Find out why you've got brain energy failure, and most commonly it's due to poor metabolism, high carbohydrate diet. And that picture I had up earlier, it showed you that when you have a migraine, you can have at least 10 other syndromes involved: gastrointestinal, cardiac, vascular, autoimmune disease. They all keep company with each other because they're all signs of brain failure or high inflammatory states, which are directly consequent to a bad diet.
Not to irritate Doug too much, but I'm asking because I usually need more salt. I get them often, and it's because I'm salt depleted.
Yes, so I'm glad you raised that, because if you read up about salt, before sugar became a worldwide, assumed worldwide importance, salt was probably even more important, because most animals and us were deficient because of the environmental place. And you remember the word salary comes from salt. Roman soldiers were paid in salt. And a lot of towns in England and Europe bear resemblance to being salt processing or manufacture, like Salzburg in Austria, for example. And New York a few years ago decided, you know what, we're going to just try and put a salt ban on excess salt in food, and it went haywire. There was no support for it. In fact, if you We all need salt, and if we have too little salt, we will be depressed, amongst other things. And if you have healthy kidneys, you can basically have as much salt as you want. So that's what the biochemists tell me. Because you'll get rid of the excess salt. And the Vikings are a good example of that. They had about 200 times the amount of salt that we have today to preserve their fish. And they seem to have no problems, and many other societies do that similarly. So salt is important. Now, if you've seen the Himalayan salt jars, the pink salt in other words, they say there's 84 different minerals in it. Now again, the biochemists that I consult, they tell me, well, it's probably the magnesium in that Himalayan salt that has the important effects on our body, not so much excess sodium. So the whole salt story is very interesting, and I think Peter mentioned it. There was a trial that showed that if you decrease your salt, it really does very little to the blood pressure anyway.
Outside of a carbohydrate-reduced diet.
Exactly, yeah.
My name's Karen Spaeth, and I do health coaching in Minnesota. But I kind of apologize in advance, an N of one question. But if somebody has outpatient surgery with general anesthesia and is released when they're maybe before they're 100% ready, and has an episode of blacking out and having convulsions, and then is brief and is back to baseline afterwards. Is that fair? Is it to the patient to call it a vasovagal because of the circumstances preceding it? Or should that person be concerned that this is one of those episodes that may warrant further investigation?
Should be very concerned. So anesthetics have an inherent risk of a lot of conditions. Stroke is one of them. Depending on what procedure was done too. Say if it was a cardiac procedure or nothing like that.
No, it was not. It was more akin to a cosmetic.
No, it requires an explanation, and you should not have many conditions have been labeled something only to be later found to be incorrect. So I'd be very, very careful about ever prescribing a label. If you look at electronic databases, I have how many people with bipolar disease have been referred to various clinics that have run that do not have bipolar disease. People with Alzheimer's that do not have Alzheimer's disease. It's absolutely frightening. And that's because somebody labeled them. They attached a label to the condition, and it turns out to be incorrect. And that's a huge problem in medicine. Rather say post-anesthesia there were episodes of alteration of consciousness that remain to be explained. That would be a far more accurate diagnosis.
And should there be a MRI further evaluation?
Very likely.
Okay.
It requires, cardiac exam, blood tests, everything needs to be done. Yeah.
Okay. Thank you.
Good morning. Lily Johnston,
Morning.
vascular surgeon, San Diego, California. In my world, I spend a lot of time talking with people who have plaque in the carotid arteries in the absence of TIA or stroke. We think of that as asymptomatic disease. Do you believe that those may in fact cause symptoms?
Yes and no. Are you aware of using transcranial Doppler for microemboli counts?
Yes.
Okay, so that would be the best technique to answer the question. Because you could have a 50% stenosis in the internal carotid artery. And, the ultrasonographers and the vascular surgeon and neurologists say, well, 50% we don't worry about it, we just follow it. But some of those people could have an unstable plaque. And the only way to really figure that out, if you put an ultrasound probe over the middle cerebral artery, so here's your blockage, and you allow the blood flow to be patterned on the screen, every now and again you may see a little blip goes blip, blip, and you see a little artifact. And those are actually tiny little blood clots that are released from the plaque over here. And so that needs to be taken seriously. Then you would say this is an unstable plaque, and your vascular surgeon must say, you know what, maybe we should intervene. Have you had experience with that?
TCD is not commonly used in my
No.
world. I
I know
also
it's
wonder
not.
about cognitive impairment, but we'll talk about that later.
Yep.
Hello, John Laspina, Boca
Hi, John.
Raton, Florida. ALS and a carbohydrate restriction diet, what are your observations, or have you seen any improvements with that disease?
Yes, there were some preliminary studies that were published in the book Ketogenic, the Science and Brain Restriction, whatever it's called, by Tim Noakes et al. Are you aware of that book?
No.
There's a chapter there on Alzheimer's disease and the ketogenic diet. One of my colleagues wrote it, who's an expert in ALS, which I'm not, so
Okay.
that's the best review I could point you to.
All right, thank you.
Okay?
Good morning.
Morning.
I'm Dr. Natasha Subramani. I'm a nurse practitioner from Indiana. I'm curious what your recommendations are for female migraineurs with adherence to a ketogenic diet, but during menstruation. So the migraines are triggered with menstruation. What recommendations are you making to those individuals? Increasing fats?
Yeah, so in other words, catamenial diets. Here's the response again. You speak English, I speak Latin. So migraines occurring at time of menses are called catamenial migraines. I guess the same. I've never come across anything that says it should be different during menses as opposed to other parts of the cycle. Have you? No, I haven't.
No, I'm just curious if you
Yeah.
feel that that ties into that imminent brain injury as much of a risk factor as somebody with the metabolic disease.
Well, the only thing I can tell you is that during menses, the brain is even more irritable and sensitive to potential impairments in metabolism, as is when you are traveling. For example, we were not designed to travel in a car, believe it or not. Remember that picture of Africa I showed you?
Yes.
That's where we were designed. And so the prolonged strange sensory stimulation we get during travel, especially air travel, sometimes many hours, our brain doesn't like it, and then it triggers a migraine because it causes increased metabolism, you run out of energy and you get a migraine. So warning sign. Menses is a similar kind of weather change is supposedly the most common trigger for a migraine because of a drop in barometric pressure. So we are susceptible to all these environmental influences that can trigger it. Sure.
Thank you.
Can be really quick.
And forgive me, do you use a vision contrast sensitivity test at all to measure brain inflammation? I keep failing mine with SIRS, but I'm curious.
No, I don't, but I think it'd be very, very useful to use that. Yeah, I haven't used it myself.
Okay, thank you.